Welcome everyone. I know everyone's streaming in right now, so we'll give it a couple more seconds while people jump on, and we're going to go into the panel. I'm excited for today. And of course, even before I get into logistics, if you have a dog or kid, no need to apologize, bring them, right? They might enjoy this too, they might learn something. And of course, if you hear a dog or child in the background here, I apologize, kind of. My dog's cute, but quite loud. All right, so we're about 1 minute past, and I'm rearing to go, and I'm excited, and I know our panelists are as well. All right, and don't worry, we're not going to be staring at a PowerPoint the whole time. I know we've all been staring at PowerPoints for far too long. But what I want to start with is just a couple pieces of housekeeping, all right, and then we're going to jump right into a really fun conversation. And it's a live conversation. So if someone says something bad, we can't edit it out. So let's be on our best behavior. All right, this could be a roundtable conversation. All right, and for those of you listening, all right, you got that chat function in Zoom. If you have questions, you have thoughts, you want to contribute, type it in. All right, I'll be checking it. I'll be bringing it up as it's relevant. Right, it'd be great to add to it. And don't worry if I was going to say Zoom out, but if you tune out for a couple seconds, we'll be sending a recording of this, and you can always watch. All right. And feel free to send it to your team and your friends, because I think this could be a good one. So I'm Patrick Randolph, as my name says in the bottom left corner of my Zoom, founder and CEO of QueueDr. All right, we're an AI schedule management solution that gets patients connected to care fast by bringing them in for earlier appointments and boosting provider volume. At the same time, boosting staff productivity. All right, I am pumped today because we have two amazing people. All right, two thought leaders. So we're going to start with Maureen. Maureen's the director of Providence St. Joseph's Heritage Contact Center in Southern California. All right, she provides scheduling and runs a contact center for over 200 plus primary care providers, handling 1.9 million calls annually. Maureen, say hi to the people, please.
Hi, everybody. Welcome. Look forward to an hour with you.
Yes, this could be a good one. And then we have Peter on the other side. Peter is the Chief Commercial Officer and Executive VP at Nystrom. Peter's led the aggressive growth initiatives there. And for the past 10 years, they've grown from 100 employees to 1,250 employees in 20 locations across 2 states. So amazing growth. Peter, say hello.
Hey everyone, great to have you here and nice to be with you virtually. Thanks for having me.
All right, so we're going to jump right in. All right, and what I want to talk about is, everyone's focused on kind of those 48 hours, during COVID where things were crazy. I want us to focus, the 6 months, the 7 months after, where we are right now. And one of the challenges has been managing remote teams, right? Internal operations. So Maureen, before COVID, you guys weren't remote, and you had to go remote during COVID and still are. Talk to me about that.
Yeah, sure. So we actually were just starting to embark on remote work. We wanted to test it slowly, just a couple of caregivers or employees at a time. So I think we probably had maybe about 10 or 20 folks that were working remote. And when COVID hit, we just immediately made the decision to move everybody that wanted to work remote home. We basically allowed them to pack up their PCs and monitors. We loaded up their cars, sent them home, and helped them connect right away. And so as of today, we have about 120 of our employees or caregivers, is what we refer to them as, working remote.
And tell me about the challenges there, as it pertains particularly to keeping, the culture. I know Providence St. Joseph's is well known for really carrying great culture. How have you adapted to keeping that culture while you're remote and keeping the staff productive?
Yeah, it did definitely require some different thinking, with folks on site. It made it easy. You could do dress up days and bring food, reward folks with, breakfast, granola bars, things of that nature. So we did have to try and figure out, how do we keep people connected? Because, you can't walk around and say good morning to everybody anymore. So fortunately enough, St. Joseph Heritage uses Teams. And so we got up on Teams right away. We established some groups and some chat sessions. And we empowered the caregivers to start those chat sessions. So each team would identify an individual that could start, the good morning chat, like, how are you today? And it was really fun to follow them. People would, say, where they were going to lunch, because remote was new to them as well. So it was kind of exciting for them to be able to connect with each other and chat with each other. And then, we took it to the next level. So, we've identified ways for them to connect, communicate with each other. And so how do we make it fun? How do we bring the fun in? And so we started bringing in games, playing games during breaks and lunches. So we did things like Family Feuds, categories. We would play music. So it was just kind of that feeling where they could kind of disconnect from their work, log into this kind of meeting session, and really kind of experience their break and lunch and have some fun with it. We do 50-50 raffles using Teams. And we're still looking for creative ways. We do dress up days. And so we have them take a picture of themselves and post it in the chat. So we're still trying to keep all of that fun alive, and still looking for more ideas.
And I'll give you guys one soon. But it's funny, entertaining adults and entertaining children is quite similar.
Yeah.
So Peter, you guys, what I want to hear, from you is that you actually have a lot more experience managing a remote team. And so I know some people are new to it, Maureen, talk to me about that. Talk to me about what has worked for you, what hasn't, share some of your best practices.
Oh, thanks for asking. So we've had staff working remote for a handful of years now. For a few years, a few years ago, we had a group of staff in one of our departments, our business office, our back end office that takes care of claim submission, insurance verification, and the like, who said, hey, it'd be really nice to be able to have the flexibility or the option to work from home. And we said, that's a good idea. Yeah, why couldn't we look at that? I mean, it was the year 2017 at the time. We thought we have the technology to do it. Why not? Why aren't we doing more of that? So what we did is we took a group, kind of a pilot group, and we wanted to just test the waters. We didn't want to shift all 50 to 60 staff home all at once. We wanted to kind of do it in phases. But before we got to that, we had to make sure that we could manage our staff remote. If they're working from home, beaming in with their team every day, and what does that look like? So we had to kind of come up with that, manage by metrics. So if we're managing by how many claims they can submit, how many insurance verifications they can do per day, we had to create that baseline. And we had all that information, but we had to look at it more closely for the staff who wanted to work from home. So what we didn't want to do is say, hey, over the next 2 weeks, we're going to create a new baseline for you so we can send you home and have staff be like, I think I'm going to try not to do so much. That way, when I go home and I'm super productive, it's going to look really good. So we thought, we bring those expectations down a bit and then just crush them, right? So we had all the information by employee within this department, actually. So we were able to create a baseline for each different kind of subgroup within the department. So we could look at the data on a weekly basis and really understand how well they were, how productive they were being at home. So when we sent home the first group of people, the pilot group, to kind of work out the kinks in the system. What's not working? What do we need to do better? Is the technology sufficient and the like? So over probably about a 3-month period, we had 50 plus people working from home, and we've continued to add people working from home. So we've been doing it for a while, and similar to Maureen, we might not have as much fun with the raffles and drawings because we don't allow fun at our company. Not joking. But we encourage all that. Check in with the team, and we've had and we'll probably talk about this later, but we've been on a telehealth system since 2012. So within our company, it's very common to just be able to click the video chat button to be able to connect with someone down the hall or across the state. So when we shifted a chunk of our staff to working from in-office in the brick and mortar to working from home, that they were used to the video solution already. That wasn't new to them. And that was a huge leg up we had, I think, rather than trying to quickly shift and pivot and get everyone from home. That's a whole different story, which I think we're going to talk about when we had to our 700-800 clinical staff from in-office to home. That's a whole different, I think, talking point we'll get to later. But for us, it was about really making sure we could manage our staff well and having clear expectations. If you don't have clear expectations, there's going to be a lot of confusion, and the supervisors and supervisees are going to, bump heads, and they're not going to know what to do, and it's just going to create more problems. So as you're thinking about staff working from home, maybe long-term, I would just encourage you to think about how can you set up clear expectations, and how can you manage those staff working from home and give them, whether it's a baseline of what they have to accomplish or just a clear expectation, so there's no frustrations between departments or between supervisor and supervisee.
No, that's a great point. The managed metrics, I like that phrase. One thing before we move off this, what our team did for remote, Maureen, you said you're looking for ideas, is based on the show Nailed It. We sent everyone little kits where they could make cakes at home. So if you follow our social media, we did it, and then we compared the cakes. Mine
Very
was
fun.
horrible.
That's a great idea.
Oh, it was.
I think I'm going to shamelessly steal that one.
Oh, do it. It was amazing. Most fun, but I want to be clear. It's the worst thing I've ever made. Embarrassing myself. But it's a lot of fun. But yeah, so going back to slightly less fun, managing metrics. Now, what at least we're seeing and hearing, and I'm curious from you, and Maureen, we'll start with you all. Everyone's got, whether it be child care, whether it be, kids in the other room, distance learning, whatever it might be. And with the rise of also more manual tasks they have to do due to COVID pre-screening, how are you using technology kind of to fill that gap a bit? I don't want to call it productivity gap because people are working as hard as they can, but talking about the role technology plays right now and you're managing that remote team and making sure you're getting those metrics and reaching those metrics.
Yeah, so we use Genesis telephone platform, and so it provides a lot of robust data. Prior to the caregivers going remote, we did have specific metrics. So there are, and there is an expectation that they take an average of 10 calls per hour, about 75 calls a day. And then there's compliance. We're in a contact center, and so we do have to make sure folks are complying to their schedule, their breaks, lunch, things of that nature. So, that technology has really helped us, and it is really the technology that allowed us to quickly move, over 100 people remote in less than 2 weeks, where the rest of the organization, it took them a little bit of time. So they had to, look into the technology that they were currently using and how could they access it to do remote. And some of them actually reached out to me to say, hey, can we jump on your telephone platform to get folks home? And we did offer, those options and kind of shared the resources. But the measures are in place. We have found caregivers to continue to be doing well. And from an attendance perspective, we've not seen a significant drop, but we've not seen an increase. Folks are really happy. As COVID was kind of winding down a little bit, I should say, prior to July, the questions came up, are we going to continue with remote? And then even after, round 2, you still had folks asking, hey, as we get closer to a vaccine, where do you see us? Do you see us coming back in? And we're going to continue to offer remote. People are really happy with it, and we seem to be doing well.
That's great. And so moving on kind of from remote managing people to kind of remote patient care. Peter, you mentioned you've been doing telehealth for a while. Right now, right, what percentage of your visits are telehealth?
Yeah, right now we're back up to 10% roughly in person, so 90% is still over telehealth. Just after COVID really hit the country and going back to March when we shifted almost fully to telehealth, we were down to about 97% of our volumes were over telehealth. So we're slowly bringing people back into the clinic as quickly and safely as we can.
And so you're seeing that increase inpatient demand for in-person visits coming back a bit. And you're in Minnesota, by the way, for those who don't know where Nystrom is.
Yeah. Yep, absolutely. We're seeing more, and not just from our staff, our doctors, our therapists, but from patients as well. COVID, one, just, not good to catch it. It can be very dangerous. But it has a lot of mental effects too, just from the unintended consequences of this pandemic, right? So there's a lot more just stress, anxiety, depression that people are having to deal with. And well, having the technologies to work from home is great, and it's nice that a lot of the companies were able to pivot, including us, QueueDr, Marine's company. But also you have to think about, okay, well, what are our staff going through mentally, and how can we best support them? Because it was such a quick change for the majority of our staff and for our patients. So we have patients already saying, hey, I want to be seen. I know I need help, but I've had too many Zoom meetings. We've done so much distance learning already, my kids have. And then,
not this one though. This is not one too many.
no,
I'm watching all these.
the last one you should be part of if you're
Exactly. Exactly.
We have people just burnt out, the Zoom fatigue, right?
Yeah.
Telehealth ending tomorrow. It's probably never going to end. So it's just trying to understand how companies can be supportive of their staff and of their clients, patients who are using video or telehealth as a means to serve them. So just keeping that in mind and we've implemented various techniques within our company to help support patients, to help support our providers. When back in March, when we first pivoted over to almost 100% virtual, we had support groups going three times per day for people who are struggling with technology and just trying to better understand, okay, how can I be successful at this? Because one, they were happy to be employed still and be able to have a job to go to, because there's so much uncertainty in the country, really the world, but within the US. Do I have a job? Am I going to be furloughed, laid off? What's it going to look like? So one, our staff are extremely happy to just have a job and be able to continue serving their patients who were in immense need of help. So we wanted to make sure that we were doing the best we could to support our staff who were in return serving our patients. So we were doing everything we could to support them and show them that we cared about them, because we know we all care about our patients and the communities we serve. So trying to quickly pivot, but do it well at the same time. And we've learned, I mean, there are a lot of takeaways during this pandemic and with technology and the like, and without technology, it'd be very, very difficult to do what we're all doing right now. And now I will say it was nice having, we've been automating a lot of our solutions, including QueueDr over the years, where it's really a click of a button and the solution takes care of itself, right? So with QueueDr, that was one less thing we didn't have to worry about, filling our provider schedules. When there's a late cancel, we know, oh, just like that, it's going to get filled up in the next 7.5 minutes. I think that's our average time to fill an appointment.
A little lower than that, but it's good.
So for us, when it used to be hours, or maybe it would never get filled. So QueueDr, and then our appointment reminder solution. So because we were, and Marine as well, but thinking proactively about technology and how it's being used, we were in a better spot to be able to shift quickly to working from home. So without technology, I don't know, and with QueueDr, it would have been very difficult to be where we are today.
And I think, and part of the reason we chose you guys is, you were proactive and you guys have an innovative culture. And that's really important. Right now, we've all been forced to be more innovative. We want to, more than we're comfortable with. I think it's, resulted in really positive changes to patient care, patient access to care, and internal operations. Now, Maureen, talk to me about where you are right now with telehealth, right? Because I think more people might be able to, are going to align with your volumes right now.
Yeah, so, we tried to really find the positive in this pandemic. And, we were able to really leverage it. Just like remote work, we were dabbling in telehealth prior to COVID, trying to get our physicians on board. And it was moving really slow. And when the pandemic hit, because we kind of already had our kind of foot in the door, we were able to get it up and running. And I think prior to the pandemic, we had maybe 100, 150 providers, and we were able to kind of jump start and get over 1,000 providers, up to about 1,500 providers, different states up on telehealth in just a matter of a couple of weeks. So, to Peter's point, the use of technology has really enabled us to get back up on our feet, be able to get patients scheduled, whether it be telehealth or in person. And of course, during the pandemic, more than 90% of our patients were scheduled for telehealth visits. We did have some clinics open that allowed for some in-person visits, because we know that there are patients that still, needed to be seen in person. So probably for a good 90 days, the majority of the services that we were providing were via telehealth. we're starting to see a shift. We've been seeing that over the last 60 days, where more and more patients are wanting to come in and see their providers. They're wanting to get out of their homes. They're wanting to connect with their doctor. I think they've saved the things that they felt that they could do via telehealth, but some patients just want to be seen in person. And all of the other, technology that we had in place, we were able to leverage it. So, for QueueDr, we had QueueDr in place for our face-to-face visits. And the minute we went live with telehealth, we immediately were able to reach out to QueueDr and make sure that they were connected into our telehealth visits. They were new appointment types that we had to create. And immediately we were able to get that up and running. So the technology has been wonderful for us. We have patients that love telehealth visits and are still using them, but we are seeing patients are wanting to come in more and more, just month after month. We're seeing it increase.
And that's encouraging. I think, for vendors like us, we've got to just be as flexible as possible, not just now, but always, right? And that was a lesson QueueDr, has had to learn the hard way, in the past, but now it's a tenet of our company, which is, we don't want people to have to change for us, so we have to change for you. Peter, when we were talking before this, you had mentioned something very interesting about how, when telehealth, kind of the rapport that is built, it almost had to be restarted, right? And as it's going back and forth, talk to me a little bit about that.
Yeah. Well, in healthcare in general, the rapport you have as a patient with your care provider is extremely important. You want to make sure that it's the right fit, a good personality match, and it can take a while to build that rapport up. So if you're being seen for therapy and you're going in once every week or a couple times a month for months on end, it's important to make sure that you have that good rapport built up. And when we made the switch and we pivoted to fully providing telehealth services, we learned and we saw from what was going on within our own organization that our providers had to almost rebuild that rapport with their patients, because the general community wasn't used to doing video meetings on a daily basis or ongoing throughout the day yet. This is still, beginning of pandemic. So trying to get them to open up and talk about what's going on in their life, whether they're suicidal or struggling with alcohol addiction or added anxieties and stressors. It's hard to talk about that, hard enough in person, but even more so through video. So it took a while to get patients and providers and our doctors comfortable with doing their services through video. And that one of the other things we did as we learned this relatively quick is kind of tips and tricks on how to build that rapport up for our providers with their patients, to help them to get to that point quicker, to better support them, because we knew we were going to be on telehealth for a while. We knew it was going to be more than the 15 days we were all promised at the beginning, and here we are almost the end of October and we're still here. So we knew that, hey, it's not going away anytime soon. So the quicker we can get our doctors engaging better with their patients and vice versa, patients engaging with their providers, the better everyone's going to be.
For telehealth visits, you mentioned tips and tricks, to help providers build a little rapport, right? It's a different medium. Any of them you feel comfortable sharing? Is there any, low-hanging fruit that you found? If providers do X, Y, and Z on a telehealth call, it makes it feel like in person or helps build that rapport.
I mean, the first thing is kind of just being able to laugh about it and say, hey, we're here, and there's nothing we can do about it, but this is the best way we can support you right now. And it's not comfortable. No one really likes it at the end of the day, but it is what it is. And we're just so happy that we can be here to support you, and just kind of break the ice that way and let them know it's not an ideal situation for anyone. And let the patient know it's difficult for the doctor, for the therapist, for the provider, as it is for the patient. And just be honest about that, because everyone's thinking it. And if you just put it out there and you're candid about it, the patient's going to say, yeah, this isn't the best situation, but I'm happy to be seeing you. And when they hear that from their doctor saying, I'm very happy and I appreciate that you're still being seen by me over video today, that means a lot to me. For the patient, that's like, wow, that means thank you.
I think one of the things we've all realized is we're all people, right? Whether it be in the call center, whatever it might be, people delivering packages, they're all people, right? And so having a level of empathy is so important here. I think you're absolutely right. And more, you mentioned empathy when we had talked prior. Obviously, remote, right? Making sure that the team feels taken care of. You'd also mentioned kind of meeting patients where they are, right? You're talking about the future and the way you communicate with patients, right? Now that you're 6-7 months in, are you thinking in the future there's going to be a different way, or it's changed the way you're going to communicate with patients, the different mediums you're going to use?
No, I mean, we're going to continue to, offer telehealth visits. And, I think from a strategic standpoint, it makes sense. Just from, the whole brick and mortar, I think we realize that people are happy working at home. And, there is a savings with the real estate. I mean, the real estate in Orange County, LA County is pretty costly. And so, if we can make physicians and clinicians and those that answer the phone happy by working from home, and we can save some dollars there too, that's important. But I think what we're looking at is, what is that sweet spot that says, we should, continue to try and offer telehealth, and how many appointments should you allow for in person? We are still learning. We're still trying to work through that. We're kind of landing somewhere around 30-70. So we want to try and leave about 30% of our appointments open for telehealth and about 70% of them open for in-person visits, just because we're seeing it. Of course, unless something else, kind of hits us and we have to change that. But, to your question about strategic, I think that's kind of really where we're going. And it's really about access, right? So it's really about making sure that we're in tune with our patients of all ages, we're in tune with our community, and can we continue to be on the cutting edge with technology, right? I think for all of us that went telehealth right away, it made a difference. It saved healthcare businesses and offices and clinics. And so how do you keep the patients in? And so with some of the online services that we offer, QueueDr. QueueDr has been extremely helpful in keeping our appointments filled. We found too that with telehealth and, kind of adding on QueueDr made such a difference. With our in-person visits, we used to have have to have a parameter, like an hour and a half, like leeway. So it really was dependent on when the patient called in and canceled their appointment. And so we had to determine, was that within the time frame to allow the patient to respond to it, leave work, drive, come in and check in. With telehealth, we're finding that people are saving time, and with QueueDr, it definitely helped too. We're able to change those parameters. So as soon as an appointment is canceled, really within 30 minutes, we're able to kind of get that message out and get that appointment slot filled. So it's definitely been helpful.
Yeah, and I think we're all, starting to get to the point where, virtual, we're comfortable with it, it's been introduced, and we're starting to find out there's intrinsic benefits to virtual, right? Like you mentioned, you don't have to drive, right? Southern California is known for its traffic. And so if you don't have to drive, right, that changed the game. How do you rethink scheduling? That's interesting you guys come down to 70-30. But you mentioned kind of the brick and mortar. Peter, you guys opened a clinic, a brick and mortar, as the kids say, clinic during the pandemic, right?
We did. We opened one and two more opening in the next month and a half.
What's that like? Talk to me about that. And the role, frankly, overall, right? Like, with more insane, brick and mortar has become slightly less important. But talk to me, for you, it seems like it almost might become more important. Yeah. Share with that.
So for us, the one we opened in the middle of summer, in the thick of the pandemic, we had already had plans to open that one, but we knew when it opened, it was going to be open virtually. So we could still market all the services that we were going to be offering there, but it was all going to be conducted via telehealth. Ultimately, we know things are going to get better, and we're not accepting that there is going to be a new normal. We know that we will get back. I mean, we're in America. We're a great country. Things will get back to how they were before. Maybe some slight changes with how people interact or how close people are, but at the end of the day, we're a people country, and we want to interact with each other and engage with one another. And our thought is that we need to continue to grow, and there's going to be more of a need for our services that we're offering. So during the pandemic, when we opened the clinic, it was just opening it virtually. And we know that already today, and Maureen mentioned it as well, that she's seeing patients who want to be seen in person. So that's quickly going to come back, where people want to be seen in person. And totally agree with to Maureen's point that telehealth is here to stay. It's not going away anytime soon. So just making sure that we're fully prepared for that to continue both service offerings, in person and through telehealth. And it is about meeting, and you said this, Patrick, before, about how do you meet the patient where they're at. And each person's so different, even though they might have some overlapping needs from their care provider. Everyone's different in how they want to be seen, and it can vary by the day. And like you said, with traffic in California, yeah, I mean, telehealth sounds great. I don't want to sit in traffic an hour each way. And if you have that rapport and you have your provider, and it's just, a return appointment, that it sounds great to be able to have that telehealth solution. It can be a bit different or challenging when you have to come in to get some type of an injection, or if you have to get your vitals. So we look at it as there's always going to be brick and mortar for our operation anyways, and there's always going to be a need to have physical sites, and even more so for our providers. And we're seeing staff who are loving working from home, but then we're also hearing people say, okay, I need to be back in the office because I don't have the confidentiality I need, or my kids are overtaking my space for their distance learning, or I've had it up to here with my family, and I just need to break 6 months. I just need to get back to the office.
I don't know what you're talking about. No one here is what you're talking about. Yeah.
If you're on the administrative team, totally, it's accepted now. That is a new norm, to be able to have kids wandering in the background. My wife and I have 4 awesome kids, all boys, 8 and under, so it's a very busy household. And there have been numerous times my 1.5-year-old or 3-year-old will run into my home office and jump on my lap and be, hey, Dad, what are you doing? And look at the screen and see there are 10 people looking at them. That cute little kid, and oh, this is my son, and you introduce them, and just go on to the next thing, because that is pretty common now. But if you're a physician or a therapist and you require that confidentiality, sometimes it's not conducive to be working from home, and you do need to be back in the office. Even though we have staff who are back in our brick and mortar clinics, they are still seeing patients virtually. So we just make sure we have the setup for them in the office as well as at their home, so they can be productive in their environment.
It seems kind of what both of you are preaching is, telehealth is a bit here to stay, but flexibility is the importance, right? Mm-hmm. As it pertains to staff, as it pertains to access to care, having that flexibility, will be really important. And we're not going to, I don't think 90% of our appointments are going to be telehealth. We're not going to live a futuristic world. Well, I don't know if it's an ideal futuristic, but a world where no one's in their house. Hopefully that doesn't happen. But I think I'm going to put you guys in a spot. What parts of COVID, and Maureen, we're going to start with you, are, what changes during COVID are here to stay, right? Within Providence St, within your part of the organization, what happened during COVID that you're going to take going forward, you're going to keep reusing, right? And what's a little more temporary? Talk to me about that.
So what we're going to keep moving forward, I think, definitely to Peter's point, telehealth. It is, we're going to keep it. We're seeing a good population of people who want to use it, and our physicians. Some of our physicians do like the break, so we definitely are going to keep it. Yeah, go ahead.
And were they if you had told them, hey, in 2 weeks you're going to be doing everything virtually, I imagine they would have said no. And I imagine going forward, now that you've done that allows for a lot more innovation, hopefully.
Yeah, it does. It allows for a lot more, innovation. Our providers are definitely more open to the possibilities, where before, I think we all, those who are not tech savvy, I think, there's a little bit apprehension about what does it feel like? How do you use it? Is it going to help me? And I think a lot of our physicians, going through medical school and starting their practice, there wasn't a whole lot of technology for some that have been practicing for years. So to try and change what they've been doing and they know works, for 15 or 20 years, was a little tough. But many of them have said, how how easy the transition was. Was it easy to, get their first patient up and running and figure out their spacing and how to transition from one call to another? That initial, learning was a little bit difficult, but the majority of them have it down, and a lot of them do want to keep it. Even the providers who are feeling like they would prefer more inpatient visits still want to keep some of those inpatient visits. So I think moving forward, it's about growing our healthcare. It's about growing our business. I think that's for everyone. And so keeping telehealth and keeping in-person visits is just something that we're going to have to do. The in-person visit, you're going to need. If a provider is trying to grow their business, you do need that touch. I think you do need to be able to come in, meet and greet your provider. And then for some of those little incidentals, lab results or, question about their prescription refill, that's easily done via telehealth. But moving forward, I think you have to have both. It's about growth. It's about the patient need. We want to, like Peter said, we got to meet the patient where they're at. And a lot of them do still want to come in.
Yeah. And that should, I think, hopefully, instill faith in a lot of people, right? The patients will be seeing, December's coming up, so we'll have the December dash. But more than, and I imagine next time you're going to doctors with, an idea, right? New technology. I imagine they're going to be more receptive, right? Not only,
Absolutely.
have you shown themselves they can make the change, but you've proven and your team has proven, hey, we're really good at this. And you're capable of a lot more than you think.
Yeah.
And so that's awesome, right? So you get a couple freebies. Going forward. Now, Peter, you guys have an interesting, your model's changed a lot. Particularly how you market, right, Nystrom, and how you guys are able to reach, get more patients. Talk us through that.
Yeah, we learned, so prior to the big pivot over to 97% via telehealth offerings, a lot of our marketing was geared towards business to business. The Nystrom to whoever that referring provider or that entity organization was. So we had a heavy focus in marketing to health systems, primary care, law firms, county offices, schools, and the like. And when everything shut down, pretty much the entire community shut down, every community, and everyone was working from home, it was more difficult to get in front of them. So we quickly switched to how we were reaching out to our prospective future patients. And we did a little bit of this already, but we almost switched to 100% of reaching out directly to business to consumer marketing, so B2C. So we were focused more on, okay, who are our patients and how do we get them in and let them know that Nystrom can help them? So what we did is we quickly switched to doing more radio ads, TV ads, commercials. We did a lot of social media marketing directly to the consumer. As well as a lot more Google ads that were very targeted in what was going on within the pandemic. The other thing that we did that was really neat, and we're still getting very positive feedback on, was we created about 35, 40 different self-help videos. And the thought behind that was everyone's struggling right now. What's going on is not easy for anyone. If we were going to just meet with each person in the community one time, what would we tell them? And we crafted these videos around addiction and how to not use alcohol as a coping mechanism, how to get along with your spouse while you're both working from home, how to support your kids during distance learning, how to talk to your family about if you've lost your job. So normal things that everyone is going through and experiencing. We went to a lot of our therapists and doctors and said, hey, can you just put together a 2 to 5 minute self-help video and just pretend you're talking to your friend about what recommendations or advice you'd give them if they came to you saying, hey, I'm struggling right now and I just need a few things, just give me a few things I can chew on that get me through this short period of time until I can get in to get professional help via telehealth. So we did that, and we've had great feedback on the videos, and they're still on our website. If you go to Nystrom,
plug them
on our menu, drop-down menu. If you just click the self-help videos, they're there, and we're going to be doing more of them, and they've very, very good feedback on them. So if you have ideas,
give me the URL. Yeah, give me the URL one more time for the people.
NystromCounseling.com.
NystromCounseling.com. I imagine we all could benefit from those videos. So that's awesome.
a couple more things, Patrick, as to what we saw change.
We're here for you.
Awesome, thank you. I'm going to keep going until you tell me to shut up here. I'm sure my wife is at home watching right now. Like, Patrick, just tell him. He goes on and on.
Dude,
calling
me.
We learned one, our team is amazing. Everyone at Nystrom, our providers, our administrative staff, our team answering the phone, scheduling our patients, everyone did a phenomenal job in making that transition from in-person to telehealth. Our vendors, including QueueDr, did a tremendous job of getting on board with the changes that were occurring and being reacting to what we needed and being responsive to those needs to help us get through the challenges. One thing that we saw is just hugely important that we started doing is we started communicating with our entire company multiple times a day, because there are so many things that were changing. What payers are covering telehealth? Is CMS covering telehealth? Do we need prior auths for anything? What happens if we can't get a patient into the video session? How do we reach our IT department? There's so many things that were coming up, and I mean, by the minute almost, we were learning how to handle this. So we've greatly increased our communication to the entire company. Before it was maybe regular memos as to what's going on, but now it's let them know, keep the team involved and engaged in what's going on within the organization, and you'll get a lot more buy-in and support to where the company's going. So that was one huge thing, one big takeaway that we've learned during the switch to telehealth, and just the forced collaboration that was pushed upon us because of the pandemic. So that's one thing that's here to stay for Nystrom, is just more clear and direct communication with the overall team at the company. So all 1,200 employees, they're probably hearing from us more than they ever thought they would, or maybe even wanted to. But now, no one can say, oh, I never knew that, because we want to put everything in front of everyone. So we're all on the same page with where we're going, what we're doing, what's it going to look and feel like when we open a clinic virtually during the pandemic, and everything in between. So just the importance of being able to communicate freely with your team, that was huge.
Yeah, and that's a great to do for people, right? Being transparent and just, we're all in this together. And I know we're almost running out of time. Maureen, do you have anything you want to add? Any last words?
Yeah, I just kind of did want to add on to, what Peter was saying and, the lessons learned. And as he was talking, I was thinking about how we did come together, when I was talking a little bit about how we were kind of dabbling in telehealth and physicians weren't really on board, and then there wasn't a choice, and now so many of them love it. But the pandemic did bring our ministries together. So, we have High Desert, Mission, St. Jude, St. Joe's. And although we worked together, there was still a lot of independence, but COVID did really bring us together. It really aligned us, put us all on the same platform, telehealth, QueueDr, booking online. We were all, dedicated, invested in our people and our patients, but the COVID really did take us to the next level. If look for the silver lining, I'm definitely going to say that's it. The collaboration and just where we're going to be able to go moving forward with technology and any new initiative, for sure.
Yeah, I think that's as great a place as any to end it. I know this has been an awful time for a lot of people. But like you said, a silver lining is, listen, it brought us all together, right? And together, people are capable of incredible things. So Peter, Maureen, I want to thank you guys. That was awesome. All of our listeners out there, both on YouTube and LinkedIn or and Zoom as well. Thank you. I know for a fact this was helpful. And so, by the way, for QueueDr, we'll probably be reaching out to you after, but thanks everyone for joining and hope you enjoyed it. And, send it around. I think there's some really good tips from Maureen and Peter here that you guys can use right now. So thank you everyone, and have a great rest of the day.
All right. Thank you. Bye.
Bye everybody.